Hi friends, a big question is, in the era of IVF, who needs a laparoscopy? Do we really need it? So welcome to Fertility Fridays. I'm Dr. 𝐶𝐻𝐫 𝐵𝐵. I'm the director of Zeeva Fertility. We're based out of Delhi NCR and have centers in Noida and Ghaziabad. So, earlier on when IVF results were at about 30-35% per cycle, laparoscopy was kind of a part of the armamentarium of the whole fertility evaluation, because we would go on in a stepwise manner. We would first give medicines, doesn't work, do a tube test, doesn't work, move on to inseminations, move on to a laparoscopy, and then do an IVF. What is the main advantage of laparoscopy? That you're able to clearly see within the pelvis whether the uterus, the tubes, the ovaries look healthy, whether there are any pelvic adhesions, things are stuck inside. Do we really think the tubes are working well or not? Now, it used to be done because IVF also had very low success rates. So anybody who failed to conceive, had so-called unexplained infertility, to diagnose mild endometriosis, laparoscopy would be done. But in today's date and era, the flip has changed a little bit, because the IVF success rates, touchwood, have gone over to about 70-75%. So in a large number of patients, you actually tend to start bypassing the process. It is an invasive process. It is a keyhole surgery, but however, still, it is a surgery at the end of the day. And therefore, when we now have a very effective tool to bypass the tubes altogether, more and more doctors, and in fact, more and more patients now prefer to just skip the laparoscopy altogether and move to an IVF, because IVF is a very effective way of bypassing the functionality of the fallopian tube also, which could be a factor in failure to conceive. So the question now is, then does anybody need a laparoscopy? And the answer is yes, some patients, and those are very selective patients. For example, one, if somebody has proximal tubal blockage, then hysterolaparoscopy with cannulation is known to have good results in terms of trying to open up the tubes. And therefore, people with bilateral convolutional block are one set of patients who could do a laparoscopy. Second, pre-IVF, laparoscopy is required in some small subset of patients. The usual mindset is, if we have to move into an IVF where the patient has to go through the injections, go through the entire IVF procedure to get into a pregnancy, then why do a laparoscopy at all? However, if a woman has very bad swollen up tubes, which in medical terms we call as hydrosalpinx, which means the tube is kind of filled with a pus-filled fluid, the concept in IVF is we would have bypassed the tubes, but what if this pus-filled fluid, enters the uterus and dislodges the embryo or the baby that we've implanted? Now, that's one set of women in which it becomes very important to clip the hydrosalpinges or remove the tubes altogether to get a good result at IVF as well. So that's one subset of patients where the laparoscopy cannot be bypassed. Second, women with severe endometriosis. This has to be individualized on a case-to-case basis. There are women who may undergo medical therapy with endometriosis suppression, and we may able to, be bypassing the laparoscopic procedure. However, if there is very severe endometriosis, very big endometriomas, the patient has a lot of pain. In that case, the woman really cannot even undergo the IVF procedure because it's so painful to her. And therefore, this is one situation again where a pre-IVF laparoscopy kind of becomes a mandate. And therefore, in short, what I want to say is that in tubal blockages, there is a small subset of patients where the laparoscopy or the hysterolaparoscopy overweighs the benefit than an IVF, and cases where severe pelvic endometriosis or very bad hydrosalpinges are seen in IVF. Then in that case, even as a pre-IVF, or you could freeze the embryos, but before the implantation process, you would need to undergo the surgery. So make sure you discuss all this with your doctor when you're making an individualized protocol and decision for what would work best for you to embark on your pregnancy immediately following the IVF procedure. Thank you so much for your patient hearing.